Welcome and thank you for attending the Amputee Coalition's December Town Hall. My name is Patrice Deichel. I serve as the Strategy Executive to our President and CEO at the Amputee Coalition. Tonight, I will be moderating this session, and we will start off with just a few small housekeeping notes. First, when you all scroll to the bottom of your screen and the menu bar pops up, depending on what device you are on, you can find that menu bar at the top or bottom of the screen will appear. This is where you can find the closed captioning for today's session, if you so choose. You can view the captioning by selecting the CC tab on the menu bar. The town hall events for the Amputee Coalition are our regular occurrences where we encourage you to join each session for the latest Amputee Coalition updates. Today, the Amputee Coalition leadership and our team will provide important organizational information and will answer questions from participants using our chat feature tonight. We will be posting several links, contact information, and resources in the chat, so please take time to reference and take those for your future use. Only the presenters and the moderators tonight will, their microphones will be unmuted. We have asked our guests to submit questions in advance so we can provide the most accurate, productive, and thoughtful responses during our time tonight. During our Q&A, we will start with the questions submitted in advance and then go into questions listed in the chat as our community members see fit. We will answer as many questions as possible. We will answer as many questions as possible during the allotted time. Any questions we do not get to will be answered in a follow-up FAQ document that our team will send out. If you are experiencing any difficulties technically, please let us know in the chat feature, and one of our Amputee Coalition staff members will be in touch to assist you as soon as possible. You can find the chat, which looks like the word bubble, in the same menu bar. If you would like to turn the chat feature off, you can do that by pressing Alt plus H. We have a large audience tonight. Thank you all for joining us. We ask for your patience as we respond to any technical issues. But first, at this time, I would like to introduce and turn things over for our opening remarks from the Amputee Coalition Board Chair, John Register.
Hey, Patrice, thank you so much. Sorry for my voice today. Got that bug that's going around. To my fellow amputees that are out there who are all joining us from all over the world, welcome. We continue to have these forums as a way to not only engage, but to also keep our collective community up to date with what's going on in our movement. So I really want to thank the Amputee Coalition, the staff, the support that they have kind of behind the scenes and presenting to make this event come together. And thank everyone who took the time out of their schedules to join this town hall. We have a lot of exciting updates and activities discussed this evening, so thank you for jumping on and being active. And if you have ever, in the past 3 months, reached out to an amputee to tell them about the Amputee Coalition, I want you to put a 1 in the chat. Put a 1 in the chat if you have reached out and you have shared. Thank you, Rich Elliott. Perfect. Lance, I see you there. Natalie, awesome. That's amazing. Susan, Karen, yes, that's awesome. So you see how this collective really is pushing us and advancing us forward because we have a vision, we have a mission, we have values now that align our community to move forward. And I'm so excited that we have leadership in place that is just pushing us in the right direction. So we have a lot of exciting updates coming up. And if you have joined us for any of the town halls, you kind of know the sequence and the drill of what we do to keep the progress and the conversation moving forward. So we cover a lot of information. So we encourage you to be engaged tonight, but also to not let this be our only touch point. There are lots of touch points that you've seen we put in over the past couple of years, and it's really moving us forward. We are here for the Amputee Coalition community and understand the gravity of serving our community and opening up many access points as possible. It is my honor to join today's town hall meeting, to engage in the community and be with all of you. And we also want to thank our community members who have joined our president and CEO, Isidro, and myself, and the AC News Flash. I hope you've been looking at those. We put those together again as another touch point to connect our community with all these updates. These will continue as you can now look for our disability allies and partners to join the forum as well. So we're growing even more. When you look at votes that are coming up, we want to make sure our amputees are getting with the rest of the population, the American Association for People with Disabilities and other organizations as well, that we are part of a collective, and they have welcomed us as we have welcomed them with open arms. We are part of a greater collective, and we continue to push that more and more. So joining, presenting, and moderating, we have a full seniors team from the Amputee Coalition, including our President and Chief Executive Officer, Isidro, Chief Strategy and Programs Officer, Ashlie White, Government Relations Director, Whitney Doyle, Youth and Workforce Development Director, Maurice Henson, Communication and Partnership Director, Shree Thaker, Support Services Director, DeLuca, our moderator and Strategy Executive to the President and CEO, Patrice Daichel, and we will hear more from them later this evening. What an honor to have served on this board and then led the organization to our transition to our new CEO, Isidro. And as I'll be handing the baton off as chair at the close of 2023 on January 1st, 2024, I look forward to continuing to be a board member and happy also to welcome our incoming. I started with him the same time, about 7 years ago. Our 2024 board chair will be William "The Bill" Perno, who is in his 7th year of service with the Amputee Coalition. And we're so grateful for him for stepping up into this role, and we're looking forward for his leadership. At this time, I would like to introduce and turn things over to the Amputee Coalition's President and Chief Executive Officer, Isidro.
Thanks, John, and thanks everyone for joining this evening. It's I love that these meetings are in the evening because it almost seems like we're having dinner together. I guess unless you're on the West Coast, then we're like an afternoon snack. But it's great to join you tonight, and thanks to John for being his incredible leadership this year as he moves away from the chair position, but still stays on the board, and still so happy to have you engaged. It's been a pleasure getting to know you, and I thank you for all your leadership so far. It's been a tremendous year for the Amputee Coalition and for the board of directors and our staff, who we are now fully staffed at the organization and happy to move forward. We have a board meeting this Thursday, and I'm happy to announce that the board will be looking at our next 5-year strategic plan. So coming very soon, likely in January, February, you as community will see our new 5-year strategic plan, which has come from stakeholder impact, from research studies, from really leaning into community engagement and what this organization can be moving into the future. We'll also be releasing our annual report. We just finished up our audit. Our 990 is finished. Our audit is complete. Happy that all that was clean and moving forward. So you will get that in January, February, as well as a full release on services for the calendar year 2023. It is a new age of sharing information with you, and I am so happy to be able to have that. Also, as John mentioned, you probably heard the lineup for this call is huge tonight. This is the first time that we have had all of our senior staff on a call. So any of you that have been wanting to see the faces behind the phone calls, the faces organizing the work, what it means to be fully staffed from this organization tonight, you will hear from the folks straight away what is going on. Our mission is to support, educate, and advocate for people living with limb loss and/or limb difference. And we seek to enhance all people's lives and disseminate critical information and resources. And along with being thrilled to be here with you here tonight, you'll hear firsthand about some of our services, some of things from the National Limb Loss Resource Center, some things from government relations, what's coming soon in our youth programs and our youth engagement program, and also what is so important in community engagement, as we continue to say that we are not only the national organization representing those living with limb loss and limb difference and to be a voice, but we are also still kitchen table peer support. We are in the hospital meeting those who are just undergoing an amputation, and we're connecting people in the times that matter. But you will hear firsthand from others about all of that work. We organize these town halls. I'm going to be very candid here and a little off the cuff and away from some of the marks that we talked about. Steve, I see your remarks in the chat, and we've had received your question this week, and we are committed to the next town hall being a live town hall. It's a lot to manage the many people on the call and do justice to all the questions, but I can tell you that none of the questions go unanswered or censored. There are a lot of questions where we share those and answer those one-on-one because we do get very personal questions. But you'll also hear from the senior staff tonight field some very real questions that were shared for this town hall this evening. So you hear that right here. We are committed to the next town hall being a live town hall, and we will figure out the logistics because oftentimes we do have more than 100 folks on the call, but it's on us to figure out how to make that happen. As we embark on this town hall tonight, though, I want us all to think about what is ahead in the future and to have open hearts and minds about how we look at our service as an organization and how we truly expand to reach the 5 million plus living with limb loss or limb difference, because that's the mission that's upon us. So as you hear about what we can do tonight, also think about how you can join us as a volunteer, how you can continue to support the organization, how we can all really lock hands together to make this a reality. We thank all that are in attendance tonight and always have our doors open if you have any other questions. But I am going to turn this over because I know we're limited on time as everybody starts talking. So at this time, I would like to introduce and turn things over to our Amputee Coalition Government Relations Director, Whitney Doyle, who is at the forefront of all things advocacy, individual and collective on behalf of the organization. Whitney, with our holiday background, it is your turn.
Thank you so much, Cass. Hello, everyone. Good evening or good afternoon, wherever you are joining us from across the country. I'm Whitney Doyle. I use she, her pronouns. I am our Director of Government Relations. To give you a quick visual background of what you're seeing on screen, I have medium-length brown hair. I am a white female. I do not have my right arm or right leg. And behind me, I threw up a holiday background since it is the month of December of some trees covered with snow with some colored lights. So I'm really excited to touch on a couple of things that the government relations team has been working on in 2023. One of those is, now that we are fully staffed, we have been going back and looking at how the advocacy program, how the certified lead advocate program has looked in the past and what we can do to change it. So there are going to be big things coming in 2024, which I'll touch on in just a moment. But for what we've done in 2023 that I'm most proud of is our AC Connect advocacy community. So if you've had a chance to log into AC Connect, I know you probably got auto-enrolled in some emails with AC Connect, which is always fun. I know myself, I definitely got those from all of my different email accounts. But if you do stick with us, go in there, adjust your settings so that you aren't getting emails every single day. You'll find that we have some really awesome community discussions there, one of which is the advocacy community. So this is where we're talking about all things in relating to advocating for yourself, advocating for others, or doing systems advocacy. So every week, one of my staff, Ryan Getty, who you've probably seen his name on AC Connect, he's going in and he's asking you all questions that are related to our policy work. So if you ever think, why does Ryan keep asking me these random questions? That's because we want to know what y'all's opinions are so that we can take that to Congress, or so that we can share that with other partners who are reaching out to us to know, what do people with limb loss and limb difference think about this topic? So please, if you're not part of AC Connect, join us. And we would love to have you as part of the advocacy community, where you can engage on all of these conversations. With that, we are soon to release a survey to ask you all straight up what is important to you. So we're going to come in with all of these different policy topics. Our team is digging in to see, how do we make this, how do we boil it down so that we can ask you in an online survey. We're going to use SurveyMonkey. Again, this should be coming out probably early January, to ask you what is important to you regarding policy. And then once you fill that out, we're going to take it back. And then in April, for Limb Loss and Limb Difference Awareness Month, we will be releasing a legislative priority list. So be on the lookout for that, please. And thank you for filling that out in advance. So that's 2023 that I'm really proud of. Looking at for 2024, the lead advocate certification training is getting a fresh look. With that fresh look, it's going to come with refresher courses. So if you are currently a lead advocate, thank you so much for sticking with us and doing your good work out in the community. We're going to give you the opportunity to retrain with us if you'd like, or pop in on some refreshing courses. We're also going to be taking new people who want to become lead advocates. So please be on the lookout in your emails for a call to action to be trained as a lead advocate so that you can help us reach all of the different pockets of the country and making sure that we're all represented so that when we come together to talk about policy and change, especially systems change, you all know what I'm talking about regarding health insurance and access to prosthetics and orthotics. We can't do it if we don't hear from you and engage you in our conversation. So that's a little bit about what we've been doing and what I'm looking forward to. Please let us know your thoughts. Advocacy at amputee-coalition.org is how you reach the government relations team. And I can't wait to hear from you. So thank you all for your assistance and your help. Next up, I have the pleasure of introducing Maurice Henson, who is our Director of Youth and Workforce Development.
Thank you, Whitney. I appreciate that. Thank you all for joining us this evening. I have the privilege of serving as our Youth Engagement and Workforce Development Director. And again, it's a privilege to work alongside Whitney, alongside all the other directors and our senior staff. And so things that I'd love to highlight from 2023 are our workforce development program. We had a very solid and great workforce development track at our national conference. The other thing I'd like to highlight is our workforce development work that we've been doing. Our workforce development manager, Trinea Reed, has done great work to find employers, to find universities, colleges, to create a robust hub of resource for our community members to interact not only with Trinea in one-on-one meetings and workforce development, but also on our job board with these employers, with these universities. And so I'm really proud to say the work that we're doing to meet every community member, where they're at and get them back to the workforce has been great work on Trinea Reed's part. In our youth engagement program, our 2023 youth camp, which was facilitated down in Orlando, Florida, this past August, was just a great initiative for youth to come together in a pro-social environment, really have that peer-to-peer connection, that peer-to-peer mentorship, also good adult, solid mentorship from not only our staff, but some distinguished special guests, like our board chair, John Register, opening up as our keynote, Shima Nixon, Cameron Clapp with Hanger Clinic, Julian Molina is a professional BMX bike rider who rides for Vans. Javon Booker is the U.S. men's amputee soccer team forward that really came and spent the week with our youth at camp and really instilled confidence, instilled pro-social development, and just really instilled a great mentorship of, kind of what can't, our young people do. And so things we've really been working on in our youth engagement program outside of youth camp is just community outreach in under-resourced and socioeconomically challenged areas across the country to be able to provide resource and support in those communities and elevate our youth voice and bring our youth alongside of us in policy decisions, in organizational decisions, in legislative advocacy alongside, Whitney and her team. And so in 2023 just was a real solid youth engagement program and workforce development year. And I'd be remiss if I didn't mention our youth outreach and engagement program outreach coordinator, Jordan Strader, who's just done a great job to really connect with youth serving organizations to really better support our youth as they enter into our workforce for youth and as they enter our youth engagement program. In 2024, I'm really excited that our youth camp will be kind of pulled out of national conference to go back to a traditional youth camp setting. And so we're excited to solidify a location and solidify a date for that here in early 2024. And then also just continued growth in our workforce development partnerships and continued growth in our youth engagement partnerships is what we're really excited for and looking for in 2024. So With that said, I'd like to take some time to pass it over to our Support Services Director, Lucas DeLuca, and I thank you all again.
Hi, everyone. My name is Lucas DeLuca. I use he, him pronouns. I am bald and I have a beard, and I'm happy to be joining you today. As a person with a limb loss and limb difference, working in the support services, I'm really excited about the work we've accomplished in 2023. As I talk through those accomplishments today, I'm going to break them down into 3 categories. It helps me and I hope it helps you. So the first bit of the work is individual supports. Many of you are familiar with our Certified Peer Visitor program. This year, we held 20 virtual trainings for our CPV program, leading to over 130 new CPVs. We are thrilled by the amount of folks who are still interested and committed to helping folks go through their limb loss journey with someone with a similar lived experience. I want to thank you all. I know there are many of you who are in this chat today who are certified peer visitors, who have given your time as a volunteer to the AC. And to you, I just want to say thank you so much. For those of you who are familiar with our Certified Peer Visitor program, you're looking to get involved, you're still interested in helping out, I would direct you to our website. We have more trainings coming up in the next year, and I'm thrilled to be providing opportunities to folks to get more involved. We have tons of exciting new work in that individual space. In regards to community supports, this year was really exciting for us. We worked with the VA to create our sex and intimacy guide. This was an amazing project in which we got to leverage experience, feedback from the community, experts, professionals in the space to help define and create a resource that many amputees and community members have been reaching out to us for some time, asking for a resource, something to define those spaces that maybe folks couldn't talk to their healthcare providers about. So we're very excited that this year we were able to launch the Sex and Intimacy Guide. And I will say it here first, we're very excited. The goal is to have a digital edition of that Sex and Intimacy Guide live and on the website so that folks can pull it from there, February of 2023. Also in the work of that community support, this year we were proud to launch our BIPOC support group, but we're even more excited going into next year. We're going to be prepping to launch our young adult support group. As many of you just heard with Maurice, there is so much incredible work going on in the youth engagement space. And we are thrilled to be partnering with Maurice and his team in putting together a support group and a space for our young adults to get together, to have conversations, and to thrive together. And then lastly, I want to talk about something very near and dear to my heart, which is our systems support. And that just means the work we're doing for folks in healthcare services, in healthcare partnerships, things of that nature. For those of you who are not familiar, we have a healthcare partnership program. We work with hospitals, we provide resources, we help them set up support groups, and we help them find certified peer visitors in their area to match with folks who are going through their limb loss and limb difference journey. I want to give a huge shout out to my team and specifically Janae Fowler. This year, we were able to add 30 plus new healthcare partnerships. And what that means is for people like my parents, when I was born and I had a limb difference and they didn't know what to do, they didn't know where to go, they didn't know who to talk to. They went to different hospitals, they went to different experts, they went to find different people because the systems that were in place didn't have a space for them. There was not information readily available. I'm happy to say that with 130 plus healthcare partners we have right now, that information is readily available to family members, to parents, and to those in need. So I'm incredibly thrilled for the work we've done in that space. As we move to 2024 and we turn the page on 2023, I could tell you that I'm excited to have more certified peer visitors. I could tell you I'm excited that we're going to be growing our virtual support groups, even to tell you that I'm excited to see even more work in the creation and distribution of resources. But what I'm really, really passionate about is education and learning. We are going to be launching a learning management system very soon, so that all of our trainings, certified peer visitor training, our certified lead advocate training, all of these things that used to have this really amazing potential, we get to put it into a space that is now more accessible to all of you. We're going to make sure that it's multimodal, that it's easily accessible, and that you can use all kinds of accessibility tools on it to get the most out of your trainings and get into that volunteer space. I want to thank you all for your time, and I would like to turn it over to my incredible partner in this work, Shree Thaker. She is our Communications and Partnerships Director. Shree, I'll turn it over to you.
Thank you so much, Lucas. So hi, everyone. My name is Shree Thaker. I use she, her pronouns. Today, I'm in my home office with a black and white wallpaper of toucans behind me. I have long, dark brown hair. I'm of Southeast Asian origin, and I'm wearing a cream-colored sweater. A little bit to touch on that I came to the AC with the background in fabrication as a technician, as a manufacturer, marketing for the field of prosthetics and orthotics, and I'm so glad to be here in this role. A few things I'm so excited to share about from this year of 2023, and I absolutely welcome feedback on as well, is migration of Prosthetist Finder from what was an independent and kind of out-of-date site onto Community Connections, a robust revamped tool that we are slowly rolling out. It is an update of self-management for user profiles, and we've added several specialty fields such as running blades, night, weekend hours, and we updated it from Prosthetist Finder to Prosthetist Orthotist Finder. Tonight, or regarding tonight, actually, we received a few questions in advance that this tool may help. So in the coming weeks and months, once it's fine-tuned and fully rolled out, please keep an eye out for it. For any clinicians who are online with us tonight, this is your invitation to create a new profile and to provide feedback via rc@amputee-coalition.org, RC as in resource and center C. So this is a beta test, and we hope to launch fully early in the new year. Another thing is, while this may be small, it's also really impactful of updating the demographic questions for intake forums. And that began with the post-national conference back in July, the post-satisfaction survey. And the evaluation teams kind of led towards this of it being more inclusive and, of course, acknowledging the vast diversity in our community members. And of course, with 2024 coming right up and some role changes and all, I wanted to take a step back, and collectively, we're all going to be refocusing in the communications department on how we connect with community members to better deliver on the topics that you want and that you need. So the comms team will be engaging in the very near future, moving forwards with community members to focus on these highly requested topics so we can have a better feel for that. And also a new / kind of an updated tool, keep it on your radar, is going to be the launching of a new storefront that has various profile types that you can order, request print materials, resources, have live tracking, order history, things like that. And I would now like to turn things over to Ashlie White, our Chief Strategy and Programs Officer.
Thank you so much, Shree. And I will start by saying I'm Ashlie White. I use she, her pronouns. I am the Chief Strategy and Programs Officer. And I am in our Amputee Coalition offices this evening. I am so lucky to be working with this amazing team. I think every day I take a moment and just think to myself how incredible this year, so a little over a year journey has been at the Amputee Coalition. For a little bit of background, for those who don't know me, my father has been a prosthetist all my life. I began volunteering with the Amputee Coalition in 2008. I went to my first national conference that year. And since then have done everything I can from a volunteer perspective, working on the provider side. My family owned a orthotic and prosthetic practice. And then I went and worked at the American Orthotic and Prosthetic Association. So I've seen this organization go through many iterations. And one of the things that stands out most to me right now is the camaraderie, the togetherness, the support that this team is showing each other is incredible. And to be able to work with these talented individuals every day is such a delight. And I hope that you all out there in the community are feeling and recognizing the impacts of the work that all of these talented individuals are doing on behalf of individuals living with limb loss and limb difference everywhere. The interesting sort of connection or that interconnectivity between the directors who spoke this evening is sort of there's this realization that each piece of the puzzle that they shared, those all require collaboration and coordination with each other. And I think that team approach is something that is catapulting us into success right now. I think I saw John like kind of taking notes on all of the different deliverables that the directors talked about. And there is an incredible momentum right now, but that is not without the input directly from the community that was the catalyst for a lot of the changes and the emphasis on certain projects that have come to fruition over the past few months. That came from you all. And like Whitney was talking about with the development of our policy matrix, we have the National Health Council that guides us on how to look at health policy through a lens where, it's like an axis where you have the impact for the community and the ability to actually do the work, the resources that are necessary for that work to get done. And there's all these opportunities in between, whether that's partnerships with other organizations across the space, or that's an opportunity to look at monitoring some things like policy developments, certain things that we regularly provide input for. We don't want to do that work without you all. It is for you and it should be with you. And so she mentioned those questions that pop up in AC Connect. I would encourage you all to pay attention to those questions, because when a member of Congress asks me what I think about current interventions for peripheral arterial disease, I tell them what you all have told us when we asked you that question. That's what our work right now is about in the policy space. And I would consider that to be true across all of the departments here at the coalition. So thank you all for your input and your continued connection to us, those of us that are working within the organization, because without your voices, this means nothing. So I will leave it at that. Is there anything that I forgot, team? You're always very good at reminding me of questions I'm supposed to answer. I didn't see any in the chat. Okay. All right. Well, I will kick it back over to Patrice.
Thank you so much, Ashlie. Thank you all. If you guys do have questions, we do ask you to throw those in the chat. Before we go to our closing, we would like to bring back up our President and Chief Executive Officer, Isidro.
So I just want to pause at this time and really thank the whole team for joining the call tonight. Everyone on our senior team, and Patrice for joining, and Anna Maria for joining as well. They're not experts in presenting or Zoom, they're experts in their daily jobs. So I hope that you all appreciate their opportunity to come on board and answer your questions tonight as they flowed through the chat and as they were shared before. We so appreciate those questions coming from each of you, and that's really what loaded the comments for tonight, and being able to share everything back with you. We were able to spend some time together for those of you that were with us at the national conference. And I know I've already seen a few folks who are in the chat who weren't at the national conference. So I want to say it here again. The organization has been through some challenges in the last few years, and we've been very upfront in saying that. And the folks who came before me were very upfront in saying that. And I've been in the nonprofit space for 25 plus years, and I can tell you many nonprofits did not survive the pandemic. And so to come on the outside of this and to be able to share with you tonight double-digit increases in our hospital partnerships, a complete transparency in sharing our annual reports and financials with you, because we're proud of where we've been and we're proud of what we come forward with. And to have all of the senior team on the call tonight share with you as an organization that is now fully staffed and ready to lead the charge ahead. I'm really proud of that, and I hope you are as well. And I hope those of you that are volunteers on the call with us tonight find the space to come back with us and join us. And those who never left, thank you for never leaving and for staying with us. With that, it gives me great pleasure to also turn it over to our new board chair who'll be starting in January, Bill Perno. And as John so accurately pointed out, Bill is not new to the organization. He brings a lot of heart and commitment into the position. And he has been, along with John and the rest of the board, the champions who have gotten us around this corner and to the path that we forge ahead. So Bill, I'll kick it over to you because I don't see any more questions. I think we've gotten to everything, but thank you.
Thank you, Cass. Thank you, John. Thank you, the executive team and directors at the coalition. First, I want to share my appreciation for the strength and courage each of one of you embodies, because our community is truly a testament of the power of human spirit that perseveres and elevates, which I experienced since coming onto the board since 2018 and being a BK amputee since 1991. I also want to thank our coalition staff for their time, their talent, the diligence they put into their work every day to see the Amputee Coalition mission is real. Thank you all very much. Thank you to our President CEO, Cass, who has truly hit the ground running this year since she started and exceeded our expectations. Together with Cass, the whole team, the board of directors, we are excited about this upcoming year and have full faith in the team's ability to accomplish the Amputee Coalition's 5-year strategic plan. As a reminder, our organization is built on the foundation of embracing diversity and providing an environment where everybody feels valued and included. As an amputee for nearly 33 years, I joined the 5 million plus people living with limb loss and limb difference and find the coalition a valuable partner in representing us. Additionally, I want you to think about this. Transparency and leadership is not just about sharing successes and achievements. It's also about acknowledging areas where we can improve together, learn together, and grow together. So we thank all of you for attending this town hall in the month of December by openly discussing topics like limb loss and/or limb difference that can create an atmosphere where everybody feels seen, heard, and supported. Here are some next thoughts I'd like you to think about. We encourage you to stay connected with AC Connect or subscribing to our mailing list and our Thrive blog. Receive our In Motion magazine, join our virtual webinars, find support groups that are near you. There is so much that you can do to be engaged in our community. This is your community and sky's the limit. But keep this in mind. We envision a world where each member of the community thrives in the way they choose. From the board of directors, the executive leadership, and our staff to our volunteers, we can make this happen in 2024 and beyond. I thank you all for looking forward to seeing you next year. Enjoy your holidays with your family and friends, and be safe.
Thank you all for joining us for the December Town Hall. We thank you for your questions, your participation. You can see in the chat all the contacts and links and ways to connect to our team. I want to thank our board chair, John Register, for opening us up, our President and Chief Executive Officer, Cass Isidro, and our closing remarks from our new incoming 2024 Board Chair, William Bill Perno, and to our wonderful senior team, our Government Relations Director, Whitney Doyle, our Youth and Workforce Director, Maurice Henson, Support Services Director, DeLuca, our Communications and Partnership Director, Shree Thaker. It has been a pleasure. Thank you all, and we wish you a wonderful, warm season. Thank you.